and welcome to the pod. I'm your host, Grace, and with us we have Shan Shan, who's going to teach us all about how to become a plastic surgeon. Thank you so much for joining us.
Thank you. It's been an absolute pleasure to be invited. So I hope to share some wisdom with you on this journey.
Oh, you will. I've wanted this industry on for a long time, so I'm very excited. Okay. But first of all, just tell me what it is to be a plastic surgeon.
Well, it's certainly not like nip tuck, which is I think a lot of people assume it to be, but it's a lot of hard work. You know, it depends on whether you're working in the reconstructive industry or in the cosmetic industry. It is a lot of work behind the scenes. But of course, the main aim of any surgeon, and same for plastic surgeon, is to do a service for the patient for the specialty that they want to get into. Yeah.
Love. You can already tell how good you are at your job. Because you do both, right? You do trauma and cosmetic.
Yes. I mean, obviously, cosmetics is entirely private, and the NHS stuff that I do is pretty much all reconstructive. But I think there's such a hybrid now between the NHS work and the cosmetic work, just because we know that healthcare funding has been slashed massively. So what used to be funded in the NHS no longer is done in the NHS. Unfortunately, I'm seeing more of it in the cosmetic world. And so I wouldn't call it necessarily cosmetic surgery per se. I would probably call some of them what I call probably functional aesthetic surgery. So, women who have asymmetrical breasts, for example, purely developmental problems such as tuberous breast. So, that is an extremely common condition where, I see probably 1 to 2 ladies once every month or, once every 2 weeks with this problem. And everyone thinks they're deformed in some way. It is just a way that our body has developed. And so in the past, when you have this kind of problem, when it's extremely asymmetrical, and you've just been unfortunate, you would get the funding in the NHS. But unfortunately, now the NHS isn't funding for such procedures anymore. So we're seeing it more and more in the cosmetic world.
Wow, that is interesting because I've never really thought about NHS funding, stuff like that, and then they've just cut it. But people still have to live with something that's really hard to live with.
Absolutely.
And so they have to pay to come and get that done.
Unfortunately,
yeah.
I mean, you can certainly try. I say to patients, you certainly can try in the NHS, but you have to go through a rigorous process of funding application, waiting for months on end, and unfortunately often being disappointed with cancellations. So, women just get frustrated and they just want to change. So, often if they can afford for it, then that's where they would go.
I totally get it. Wow. Well, there's going to be so much to cover, but let's just go back to the beginning. So what did you want to be when you were growing up? Did you always want to be a plastic surgeon?
Oh, gosh, absolutely not, actually. Unfortunately, I come from a generation, probably 5 generations of doctors and academics, and I always saw myself as a misfit. So, my dad was a maxillofacial surgeon, my mum was a dentist, and they're both, were very academic. They both had PhDs. And that was like my life almost written in the stars at the beginning. But I was always very creative. Even my time in the nursery, I remember I was always doodling and drawing. And I remember this actually looking back because my dad said, one of my nursery teachers said to him, she might be an artist one day because I was always drawing. And the details sometimes I had as a little young one, drawing people's hair with curly parts. So yes, I would say I was very much more of a creator. I loved doing things with my hands. And, I've always done art. I actually did 5 A levels, I did art along with the sciences and the maths, just to kind of keep my options open. And it wasn't until much later on, especially, being the only child of, first generation immigrant parents, who were very much like, no, being an artist, you're not even going to be able to afford to put food on your table or have a roof over your head. It's quite outdated thinking now. But for that reason, I didn't want to stay safe, but I wanted to do something that was a bit out there. My dad didn't think that surgery was a right fit for women, and certainly having gone through it, I understand why, because is so physically and mentally and cognitively demanding.
Really?
Oh, so much so. You have to pay so much personal sacrifices to become a plastic surgeon. That's only just the very beginning part of your journey. So, and certainly I've paid a lot of personal sacrifices for that reason. And, but, you know, he was a maxillofacial surgeon. And then I thought, you know what, I would do something different. I'll become a plastic surgeon. And so I sort of went and found some experiences that wasn't in the textbooks. You know, I did quite early on, I did some charity missions out in Africa.
Wow.
Started in South Africa, then to Malawi, to Uganda, to Bangladesh, and I saw a whole wide range of plastic surgery and what it offered for people and in service of people. And, you know, the breadth of work as well, whether it being, you know, young kids or to adults. So, and it was very creative. So that's when I thought, right, that's probably the specialty I'll get into.
You found a way to keep your creativity while still, you know, being in the medical field.
Yes, exactly.
Which is impressive. Well done. I didn't know there was a crossover. When
Yeah.
you say like you gave up personal sacrifice, especially at the beginning, like what would be an example of that?
Oh, so much.
Really?
You know, as what you've seen in the media, you know, the personal sacrifices that junior doctors having to offer. You know, firstly, medical school is a grueling 6 years of, you know, studying, intense exams, huge amount of competition. And then it's, you know, about trying to climb the professional ladder. Unfortunately, it's not like any other industry where if you perform well, you can jump hoops. You can't in medicine. You know, it's bought with time, and time gives you the experience that you need. And I would say to become a plastic surgeon, certainly in the UK, is probably the longest in, you know, out of all the training programs to become a plastic surgeon internationally. Yeah, hands down. You know, you have to, after 6 years, well, probably now 5 years in some medical schools, 6 years for me in medical school, then it's another 2 years as a foundation doctor, and then it's another 2 years to do general surgery. Often that includes elements of, you know, plastic surgery, if that's what you wanted to enter into, and then another 4 to 6 years of specialty training, you know.
Oh my gosh.
Yes.
It's a lot of time.
Absolutely. And then even after that, you know, some people want to subspecialize. And so, you know, I did some of that, and I went off and did a cosmetic fellowships and head and neck reconstructive fellowships. And, you know, that added to even more time. So,
Oh my word. You
Yeah.
have to really want it.
absolutely. You know, I
Yeah.
think it's probably the one area of, I mean, a lot of professions, I think you really need a high amount of passion for what you do and discipline and resilience and going through all of that and faith at the end of the day to actually really anchor you through some of the really difficult moments. Because, you know, training it took me all over the place. It took me from London to Chelmsford to Manchester, because these were some of the great, you know, plastic surgery centers, well known for their training at the time. And it's hugely disruptive. You know, I sometimes often just lived out of suitcases and constantly from one hospital accommodation to another. So, you know, although things have meant sadly relationships, for example, had to sacrifice.
It's huge. You don't really realize how much goes into it.
No.
Especially like you say with you specializing. So you said you did a fellowship in like neck reconstruction, did you say?
Head and neck reconstruction.
Wow.
Yeah. So that was in New Zealand. And I love, as I said, I love the creativity aspect of plastic surgery. I've always been a very handsy girl, I must say. You know, my dad was a max fac surgeon in China, and you know, I wouldn't do this at home anymore, guys. Is that my dad always used to have scalpels in the house, you know, just lying around, bits of medical kits. But, you know, some of my earlier experiences were, you know, just using the knife. You know, he used to send me to fish markets as a kid to go to get some food, you know, like at the farmer's market. So, and I loved to used to go to the fish market because I knew that he'll teach me how to gut the fish and things like that. Yeah, so all of that sort of just taught me to be. What was the original question? I'm like, this is the thing. Like,
No, it's
when
fine.
I get
It's
into
so
it.
fascinating.
Yeah.
But it was about how you got into the neck and
head and
reconstruct-
neck. Yes, yeah. And so, and like one of the ultimate things I thought, gosh, where creativity can really take me is to reconstruct a face. So it was something that wasn't quite available. Just because the division of labor between different specialties, I didn't quite have in Manchester. So I went out to New Zealand where they did an extremely high volume of this. So, patients from isolated communities sometimes can come with massive fungating tumors that required resection and reconstruction.
And that's just something they're born with. It's not necessarily something's happened, or it can be something's happened.
Yes,
Yeah,
both.
both, yeah.
It can be trauma. So
Yeah.
if they have any facial injury that, unfortunately disfigure them, then that require reconstruction. As well as, especially in Australasia, the UV is the highest in the world. So many patients have skin cancer because of the UV exposure. I remember time in COVID when I saw a patient, he had a mask on, and you just assume, okay, fine, in COVID, everyone had a mask on. But when he removed his mask, essentially his half of his face was just eaten away by this fungating tumor.
Oh my gosh.
And believe it or not, sometimes you can find even things like maggots in the depth of those wounds. And all because of neglect, or because this element of psychology, of course, and it's quite hard sometimes to seek the right medical care in New Zealand. And so for all those reasons, you do see a huge breadth of, complex problems that we actually don't have, we certainly don't see in this country.
If someone comes to you with something that you've never seen before, how do you even know what to do? Where do you begin?
Oh well, that's where training really teaches you to go back to basic principles. So,
Right.
There's often things that I've, even as a consultant now, that maybe I've seen very rarely, and this is why there's still case reports and things being reported internationally, because there's always going to be those kind of cases. So it's breaking things down to key principles, like what is the problem, how does this affect the patient, what are the key anatomies and the structures that's being affected that can impede on patients' function, or being able to live their daily lives and enjoying their hobbies. And doing some scans, often that will be quite useful if it's relevant, and plan your surgery and your reconstruction accordingly.
Wow. What happens if something goes wrong or something not to plan?
Yes, well, you're always taught to have a plan B in
Okay.
surgery to a degree.
Yeah.
But of course, even then, you can't think of every eventuality, right? And this is where our systems come in place. And, having friends and colleagues is really, really important. So, of course, every surgeon, and all honest surgeons will tell you, every surgeon will have complications, because that's the facts of life. If you do something enough, something, even a minor oversight can result in sometimes unfortunate, catastrophic errors.
Course, yeah.
So one is, of course, being totally honest and take accountability, look after the patient first and foremost. And often we have teams of people who we can call immediately for support and help.
Wow. It's a real like you can't do it alone kind of thing. You've got to have the right people around you. But it's also nice to hear that, and you would hope it would be, but it's very patient first. Like even you saying, making sure they can enjoy their hobbies. Like it's not a one size fits all. You're really taking into account the lifestyle of the patient.
Yes, absolutely. I mean, for me, every patient is not a case number. It's not I'm doing the same operation for each patient each time. I think of every single factor that's related to the patient. And this is particularly when it comes to plastic surgery, because it's so diverse. And when it comes to reconstruction, there's so many elements of it that I would think about. If I was to borrow a bit one tissue from one side to another, and I would think, well, how would this impact on the patient? Where would the donor site be? How would they recover? What are their medical fitnesses like? So all the things are so integral to how you make a plan for a patient. So it's never one size fits all. And, I bespoke all my treatment for my patients.
Wow. You've got to be empathetic, and you got to really go at a slower pace, because panicking or rushing is never going to work in that situation, right? No matter what situation you're in.
No.
How long are these surgeries? How long are you in surgery for?
Okay, well, that is, really depends on the complexity of the problem. Some simpler stuff, of course, if I'm removing a skin cancer or if I'm decompressing a nerve in the hand or limb, that's predictable surgery. But what's unpredictable is often trauma. And so, just to give you an example, not so long ago over the Easter weekend where I was on call, I operated on a child who unfortunately avulsed his finger on a fence, and that required a reattachment, and the vessels we're talking about is less than 1 millimeter in size. And when these structures get torn, they often cause further damage to actually not just at the point of injury, but often extend beyond the zone of injury of trauma. So then it's really just connecting pipe work. We know that there's a bit of an amputated part. Of course, we'll do our absolute best to reattach it. So we know that tissue required for it to stay alive, it needs an artery that brings in the blood vessel and the healthy nutrients and the oxygen, and of course bloods to be diverted to remove things away to make it viable. And so often then you're having to borrow tiny little veins from where you can spare, often, the foot or the arm. So where you can actually plumb, it's literally a bit of, plumbing work to connect the damaged bits to the others so that, the blood flows into the tissue and out of the tissue and hopefully will stick and recover. And that took 7 hours that day. And sometimes it can take longer.
It's wild. It's a long time to focus, isn't it?
Yes, absolutely.
It must be exhausting. What kind of, when you have something come in like that it's with a child or, something unexpected, that must take a toll on you. Or do you separate that from the emotion, if that's possible?
I think that's a really good one. But again, it's something that is drilled into you from day one of training, and I think that you are often desensitized, that you remove not that you remove emotion entirely in a way. You're stepping into a zone of flow state. For me, when I'm operating, it's my favorite time, because I'm literally stepping into a different state when it's almost meditative, and I'm almost on autopilot. It feels like my brain, my hand is all acting in synchrony, and that of course takes a huge amount of time to train and to experience and to go through, and it becomes second nature even with time. So yes, of course, that human emotions can impact on your decision making, and it's so important that at the critical points you don't let any fear really trying to stop you. But of course, it doesn't mean that we're disengaged from the person, from the patient, and because so much of medicine is deeply about humanity.
It's wild, like how much you must have to deal with and think about. With the non-trauma surgeries, and if people come to you for cosmetic, is there anything you've ever been like, no, I don't want to do that?
Look, I think there is several factors to really consider. Firstly is the psychological readiness of the patient. I think there is so much misperception now with the social media, with ever fast changing pace and AI, completely distorting reality sometimes. And it's added huge amount of confusion for patients. And it's not often, it's pretty frequent, I would say. Sometimes, people would have used, everyone's a bit of a Dr. Chat GPT these days, have Googled what is it that they're hoping to have and what are the implications and the potential outcomes. And my job now is actually not to mislead people, but actually really help to break the facts down into really simple, digestible facts so they are not overwhelmed by information overload. And so when patients come to me and they have overread or have feel they're prepared, but actually, doing themselves a disservice, or, extremely worried, that is when I sort of really take a pause and really say, think very carefully about what you're going through. I never try to pressurize patients. They need to understand that anything cosmetic means that it is technically non-essential. It is about enhancing. It's not restoring anymore. Part of that is restoration, but it's about enhancing form, right? And so if we are enhancing form, it means that we have time to really think about whether there's the right thing to do. Are we just following a trend because this is what, TikTok or social media has taught us, or AI has taught us, or is it something that, the patient will be happy with in the next 1 year, 2 years, 5 years, and 10 years. And for any honest plastic surgeon, it would be providing lasting natural results that patient would identify with even years down the line. So I very much caution patients to do their research. I don't even mind if they shop around and speak to surgeons, because it's very much about building a relationship. Surgery is going through something that is quite traumatic, that is life-changing, that is permanent. And doing that safely with a person you trust is so important. So, it's not often, it's not infrequent, that I do also, meet women who unfortunately have had surgery abroad and been hugely disappointed. There have been so many horror stories that we've read online or in the media that really worries me. And I feel like it's my duty as a surgeon here to really educate women about that.
100%. Because I do feel like people going abroad and getting something done, you hear about it so often now. And sometimes I'm sure they are really good. And I know it's like a cost thing, isn't it? But it is scary, isn't it? Because if people come to you wanting something fixed they've already had, that's just another traumatic event for that patient.
Yes, of course. And, I never like to attach figures to health. Because you know what? Your health is worth everything. And I often feel quite sorry for these ladies, and I do my best to do what I can for them.
Definitely. It is super interesting as well, because with you saying about TikTok and, everyone's seeing that, have you seen a rise in specific surgeries, or it's just a rise in people wanting it?
I think there's definitely a rise in people wanting it. Firstly, because, you do have the Kardashian effect. So, making plastic surgery look normalized. And, back in the days when probably people wouldn't necessarily openly talk about it, but there are a lot of patients now have to talk about their surgical cosmetic surgery journey publicly online, and so it's become normalized. I think I read a figure even years ago, and this is in North America, where you can get better data for this. Something like 1 in 10 women have breast implants, which is shocking. And this is many years ago. Gosh, I wonder what that figure is now, given that so many people, there are so many programs out there that really have encouraged, I think, bodily enhancement and has normalized it. And so I think we have to be quite careful in how we serve the patients, and consent and informed consent has become even more important because of it. And in terms of trends, of course, when trends happen, it goes up, but certainly by this is the nature of trends, a lot of it comes down. But one thing that has persisted in the last, I would say, probably 2 years, it have been, these weight loss medications has massively changed how people seek cosmetic care as well, because all of a sudden, we're seeing massive weight loss in a very short space of time, when normally if women have persevered in their journey of weight loss journey, their skin would have retracted to a degree. But, in with the medication, your skin hasn't had the opportunity to do that. So very much so, I see women sometimes have excessive skin hanging in different parts of their body that requires, quite aggressive, body lift surgery, whether it being arm lift, tummy tuck, thigh lift, breast lift, faces as well. There is a stigmatized look almost for women who go through, rapid weight loss journeys with these medications. So that has certainly bumped up, body contouring surgery or facelift surgery for that reason.
Yeah, that is crazy. You don't think of the repercussions because you're right. Now everyone's losing weight. People are going to have something to say about the way they look with that excess skin and stuff. So there's just constant circles of things that people have to get done, which is such a shame. With the surgery side, and whether it be the trauma side or whichever, like, what's your greatest like triumph? What are you like? This was really hard and it was really successful, or what was someone really pleased with? What's a success story that stays with you?
I would say, honestly, is a patient's smile.
Yeah.
Whether it being cosmetic or whether it being reconstructive, it's the change that you see in people, the confidence that they carry, after surgery. I've spent, and this relates even to my medical charity trips, even sometimes doing the tiniest of operations, removing. I remember, working in Malawi, removing a lipoma, which is a benign fatty tumor from a young girl's forehead. In her community, she's unfortunately, considered as if she is possessed because she had a quite large bulging lipoma, which in this country, people wouldn't understand. But in isolated communities, people are not always so forgiving. So being able to do a simple procedure like that was life-changing for her, where she wrote a beautiful letter of thanks to sometimes the patients I help in the NHS who've had a life-changing traumatic event, often from a split-second injury to something that required a prolonged reconstructive surgery and an even longer recovery journey, and going through that with them and holding their hand through that journey has been just seeing them transform at the end of it has been hugely satisfying.
That's amazing. That's why you're so good at your job, I guess. That's why you do it. Because if somebody said they wanted to be a plastic surgeon, what would be your advice to them?
Yes, well, I would certainly say, follow your passion. Don't go for the trends because, as I said, going through any surgical discipline is extremely exhausting. And you are spending at least, depending what country you're in, spending between 6 to 10 years just to come through the training process, which is extremely competitive, rigorous, and really takes sometimes the shining side of life away, in your 20s and 30s when everyone's out having fun and you're having to spend time working and studying and being on call. And the long hours I've spent, I think the longest time I was on call was, 2 days nonstop.
Oh my gosh.
And you're having to do so much. And the discipline that is required to go through that. So it's not for the faint-hearted. And for those who come through, really is what passion in the subject is so important. Don't do it for external validation reasons or what someone else tell you to do, but to do it for the love of it. And if you come through that process, almost like a baptism of fire, you will really get to enjoy it because it is so rewarding. And it's only becoming my own person and becoming a plastic surgeon do I really see the benefits of what it truly means to be somebody of service. Yeah. And it's not for the surgical accolades or the titles, but it's purely service.
You've got to be all in.
Yes.
What kind of surgery takes 2 whole days? That is crazy.
Oh, that's more on call. So when I was
Yeah.
a junior doctor, I remember this was in a quite remote hospital, won't say where, but yeah, it was just extremely busy. So one thing would come in after another, and it's often trauma. So and you are the front line, so
Yeah.
you are expected to deal with all of it. I remember at the end of my shift, I literally had time to go on a Monday morning, get home to the hospital on call room, brush my teeth, and then come straight out to present all the patients I had seen over the weekend on the morning round. So, you know, it was,
You must be running off adrenaline at that point,
yes.
because when we're sat in hospitals, we don't realize, how much or how long you guys have been working. It's amazing, really, that you can still function. It's crazy.
It is hard,
Yeah.
burnout, exhaustion is a huge part of it. This is why, I think burnout happens more if you don't love the job.
Yeah.
And so, this is why it's so critical to choose wisely what you do. And, I support the junior doctors in what they're rallying for, because I've been there, been through that. And you're absolutely right. At the end of the day, people can be unkind, having huge amount of expectation, but I hope that they remember that we are human too.
Yeah,
And we will
definitely.
get tired. We will, require rest. And it's about having some humanity and understanding and compassion for what we do.
Most definitely, because it's not something everyone could do. What is the goal for you? Is there an aim? Is there a certain surgery you want to do? What's the dream?
Oh, do you know, I think I'm a more of, as much as I know everyone's pushing for sub specialism. If you look at my training, I've been a bit of a jack of all trades. I've been a little bit more of a generalist, from starting with hand surgery to then going into peripheral nerve fellowships, to then going to head and neck reconstructions, to then cosmetics, to now going back to hands. I love the breadth of work of what I do. This is exactly why I chose to do plastic surgery. I like anything that is requires a lot of finesse, a lot of delicate work. I do enjoy microsurgery, or even what people consider super microsurgery, because I do find it very intuitive and fascinating, and as I say, almost meditative in the way that these surgery can be performed. So yeah, it's my my passion. I mean, is really, I'm living my best life, really, is using my passion and using the skills that I've accrued over the years to recreate, and and hopefully one day, doing some bespoke surgery, maybe that has never been done, who knows,
Yeah.
and really working at the forefront of my specialty. That would be amazing. It would be absolute privilege to do something like that.
And that's a possibility, right? That there's still surgeries you haven't done or know about yet that need to be done.
Yeah, I mean, I think this idea of you have become and you have landed isn't quite true.
Yeah.
I think in life, you're always in the state of becoming. And if you look at any industry of the successes that people have brought in, it's because they've pivoted, from one thing onto another so much, and they leverage their skills from different aspects. So I think this idea that you've landed and that you sit in this comfortable zone of where you think you are in life, that's
It's not real.
no.
Yeah.
And I'm somebody who's always curious. I always have a growth mindset, and I'm always wanting to push boundary above and beyond what I can do. And as cliche as it sounds, sometimes really sky is the limit, and it's all about your attitude towards life and how you want to develop both professionally and personally. And there's so much crossover between that.
It's inspirational work. It really is. And it's like
Thank
nothing
you.
I've heard about. So I can't thank you enough. I mean, is there any words of wisdom you want to give in the profession?
Oh gosh, I think keep chasing your dream. I think that is a number one thing. And, no matter what you do in life, I follow my golden triangle of whilst pursuing your passion really is have faith, which is going to help you anchor through the difficulties, have a resilience in building through all the challenges and the pains that you're struggling in life, and they will come.
Yeah.
And also, have the discipline to go through it all. So, my top tip for success in life it really boils down to all those three things. Okay, so look, I guess my journey has been a little bit rocky and quite unique in the sense that, unfortunately, looking at me and now, and you probably think, wouldn't think much of it, but unfortunately, I have been through not one but two traumatic accidents. One was actually 2016. And as I said, I loved art. So I used to, after work, go to these art classes. And I remember cycling from the hospital after my shift, going to an art class in the evening on my way back on a sunny day. I was run over by a young driver who was just a little bit careless. And, I was a patient at the time. And, this is why I'm so careful about listening to patients and understanding where they come from, standing as a healthcare provider now, because I knew something wasn't quite right when I was having pain down my leg, down the back of my thigh. And I was a little bit written off by GPs and doctors saw me at the time and thought, oh, this is all just musculoskeletal related, you'll be fine. And it really required me having a lot of, I suppose, self-awareness and really persistent self-advocacy to go back and say, I really don't think this is right. And I insisted on an MRI. They actually found a slip disc.
Oh my gosh.
That was not recognized, and I only received treatment quite late, and to this day it still affects me. To, of course, a few years later, having been involved in a quite catastrophic car accident where, unfortunately I lost my partner in that same car accident, and I was extremely unwell for a period of time. And when those things happen, and you never think in life that, it will happen to you, this is when I sort of, really had to stay still and rethink my life and reposition myself, really staring myself in the mirror. I think building relationship myself with the hardest things that I had to do after such events, because once you're stripped off all the identities of what the world perceive you to be and you're in isolation with yourself, it really changes you, And this is where I learned that there's two ways you can really pivot in life, accept pain that shrinks you, or, turn pain into something greater than that, into growth, into development, and into purpose. And so in all that I do today, I'm incredibly grateful that I still get to be here, get to do what I do, despite everything that happened and the journeys that I had to go through, is that, firstly, understanding who I am, and number two, understanding what I'm bringing to this world. How do I, leave this world in even the little bit that I can do in a slightly better place. It is really a miracle that I'm still here, that I'm still performing. I've been invited to the House of Parliament and to talk about that at one stage. And there's just so much misperception of trauma, in so many ways, even by the people that are there to deliver the service, because unfortunately it's an international problem that so much of healthcare is fragmented.
Yeah.
And through that process, I had to spend a lot of time navigating for myself, understanding actually how I was going to recover, and how, you know, actually required a lot of calling friends, you know, asking for advice and help, and meeting the right people at the right time, who just taught me to never give up. You know, I met an ex New Zealand ombudsman, you know, somebody employed in the parliament, who actually is a barrister who I just happened to cross path in New Zealand. And not only was he so supportive in my recovery at the time, because I didn't understand how much legality came with every accident as well. So I really needed him. But he was also an incredible black belt, you know, karate trainer. And some of the things that he said to me, he became almost like my mentor,
Wow.
you know, during that difficult time when I was recovering in New Zealand on my own. And one thing he said was, you know, never give up, Shan Shan, never give up. And that stayed with me till this day, because I must say, after my accident, I resented my job in a way, because, you know, it was on a work trip away that I sort of, when this accident happened, but also, you know, I didn't necessarily get the support that I needed at the time from my own employer. For sorts of reasons I won't go into. But, you know, of course, I understand where that stems from. It stems from fear. Because ultimately I was labeled as a disabled person who probably wouldn't be able to ever get back into work, you know, and I just needed that one opportunity to prove them wrong. And his words, you know, stay with me to this day. So, you know, for anyone, yeah, absolutely, for anyone to go through this, is to never give up.
It's amazing you went back to surgery after all that, because I can imagine it can be quite triggering, and you've been through so much, and also having to prove yourself at the end of all of that as well. It's truly inspirational. Thank you so much for sharing that. I really appreciate it. And you're right, the resilience you have definitely makes you a better surgeon today. I have no doubt.
Thank you.
So thank you so much. I appreciate that. Thank you so much
you
for
for
joining
having
us.
me.
I really appreciate it. And wow.